We're giving this webinar is on the family experiences during COVID-19 data webinar. It is brought to you by the Department of Public Health and the Department of Social Services. We wanted to share just really quickly that the viewpoints and thoughts that are shared today are not necessarily representative of the California Department of Public Health, the Department of Social Services, or the state of California. Just a couple Zoom housekeeping items. So today we've muted the lines, but we would just like to remind you to also mute yourself. If you're noticing you're having any technical issues, please consider sending a message to the host through the chat box. But we really hope that there's some time for questions and answers. And so if you all are interested in making any, asking any questions, please do so through the Q&A functionality of Zoom or in the chat box itself. Just real quickly about the project that's bringing this work to you is about the Essentials for Childhood initiative. This project is funded by the Centers for Disease Control and Prevention, and it's in its second cycle of 5-year funding. Essentials utilizes a public health approach to addressing social determinants of health and to reduce and address adverse childhood experiences and child maltreatment. Essentials is a coalition of more than 80 organizations that are represented by state, local, nonprofit, and philanthropic organizations across California. And the backbone agencies for this project includes the California Department of Public Health Injury and Violence Prevention Branch and the California Department of Social Services Office of Child Abuse Prevention. More information can be found on Essentials on the CDPH website. Next, I want to introduce you to our webinar presenters. We're very lucky to have Dr. Lori Turk-Bichachu, who is a Senior Program Director for Kids Data with Population Reference Bureau, and Dr. Robert Segi, who is the HOPE Project Director at the Center for Community Engaged Medicine at Tufts Medical Center. And so please join me in welcoming them. And Lori, I'm going to turn it over to you.
Thank you very much. I'm very happy to be here today to talk to you about another information and data resource about family and children's experiences during the COVID-19 pandemic. Next, I'll be covering several areas. First, I'll give you an overview of the questionnaire, which brings together this data information that we are about to share. I will cover some high-level findings from the United States and California. I will also cover how you can access the California data yourself to be able to use in your work. Then Dr. Segi will be talking about the implications of the U.S. findings. He's going to dive a little bit deeper in terms of what the findings mean, what's the context. And also he will share about data snapshots on the national level data. So first of all, next. Thank you. First of all, for the questionnaire overview, this work has been in developing for nearly a year. So shortly after the pandemic began, this idea and this work has been developing. And you are among the first people to learn about these data and get access to them. So we're really excited to be able to speak to you today as this first audience. The national data snapshots were released just last week, and the last of the California data were released on kidsdata.org just a couple days ago. So this is all very fresh and new information. Next. The purpose of the questionnaire is to inform on the effects of the pandemic on children and families, and the audiences that were in mind while developing this work, it was child-serving organizations and medical practitioners. However, the audiences could be many, so also advocates and many others. Now, this work, it really should be conceived as one survey, but two samples or two bodies of work. So from this one survey, there was a national sample, and that we will be sharing national findings. And in addition, there was a California sample where we're sharing state level findings for California and some sub-state findings. This was based on a web-based questionnaire, which had 48 questions, and I'll cover the content of those questions later. And this is based on an internet panel sample, and after sampling, the data were weighted to reflect the caregivers of children who were 0 to 17 years old. There will be 3 waves of the survey. Wave 1 is what we are presenting to you today, the findings from Wave 1. That was in the field from November 9th until to December 11th. Wave 2 just concluded in the field, so we haven't even started looking at the data yet. So basically that's from April. And Wave 3, we expect to put in the field in a couple of more months. Next. The primary objective for these 2 bodies of work is very similar yet distinct. For the national part of the work, the primary objective is to measure the impact of the pandemic on family life, adverse experiences, and positive childhood experiences. And also in addition to that, their objective was to develop tools and resources for pediatricians and home visitors. For California, there was really a geographic objective as well as a demographic objective. First, for California, we wanted to inform on experiences of families and children for the state of California and within the state. And then in addition to that, we wanted to inform on the experiences of families who had a child with special healthcare needs in the household. Next. There are a number of collaborators that were involved for the national work. It's the American Academy of Pediatrics, CDC, Prevent Child Abuse America, and Tufts Medical Center Healthy Outcomes from Positive Experiences. For the California focused work, the collaborators were the Lucille Packard Foundation for Children's Health, the Essentials for Childhood Initiative, who's hosting our webinar today, and the Kids Data Program at PRB. Next. To cover some demographics of the samples, I have separately here describing the US sample and the California sample. And the US sample had 3,000 respondents across the US, and California sample had just above 1,500 respondents. We expect about the same in Wave 2 and then again in Wave 3. In both samples, just over half of the respondents were female, and about 4 in 10 had a high school diploma or less, and about 3 in 10 had a 4-year degree or more. In terms of family income, about a quarter of the respondents in both samples had an income of under $30,000, and about a quarter had over $100,000 or more. Also, around 30% of the caregivers reported that they had a child with special healthcare needs in the household. Next. And then a little bit on the demographics in terms of race ethnicity. In the US sample, 12% of the caregivers were Black, just over half were white, about a quarter were Hispanic, 3% Asian, 1% Native American. In the California sample, 5% were Black, about a quarter were white, just under half were Hispanic Latino, 9% Asian, and 2% Native American. Next. For the content of the questionnaire, it's actually quite a broad questionnaire touching on many subjects that really touch on families and children and what they might be experiencing during the pandemic. The content in broad categories is what kinds of disruptions were children experiencing, especially in education, healthcare, and in their social activities. Also, it covers emotional and behavioral health, particularly for the caregiver. It also covers economic security for the household, child and caregiver safety. So in particular, this is covering things such as harsh punishment for the child and caregiver experiencing intimate partner violence, both certainly risk to safety. The questionnaire also covers adverse childhood experiences, positive childhood experiences, and there is also a special section specifically for the caregivers who have a child with special healthcare needs about their experiences for caring for that child during the pandemic. Next. So I will be covering some highlights of the U.S. and California findings. So from those, the content that I just mentioned before, we've selected a few of them to share with you, and then later I'll show you where you can find additional findings on your own. So I'm covering both the U.S. and California distinctly on the slide, so you can see what's happening in these two different sections of work. Next. So first, we're talking about disruptions, and so this is about how children's lives have been disrupted during this period, specifically from March to November 2020. So caregivers report, 64% of caregivers reported in the United States that their children's schools were closed, and this is for school-age children. About just under a third of caregivers reported that medical and dental appointments had been canceled for their children ages 0 to 17, and 13% of caregivers reported vaccinations being postponed for their very young children, those who were ages 0 to 6. California, similar. School was closed. Caregivers reported school closing for their school-age children, 72% of them. 29% said that their medical and dental appointments had been canceled for their children, and 16% had vaccinations postponed for their very young children. Next. For emotional health, this here is specifically on the caregiver's emotional health, and we're looking at it in two different ways in this place. So from March through November, caregivers reported whether they felt that difficulties were piling up, and they also reported on whether they felt nervous and stressed most of the time or always. Both in the US and in California, about 1 in 5 caregivers reported that they felt difficulties piling up most of the time or always between March and November. In the United States, 37% of caregivers reported that they felt nervous or stressed most of the time or always, and in California, it was 34% of caregivers reporting feeling stressed or nervous. Next. Economic security, this is a family household situation, their finances, and this also we look in two different ways here. There's more data that you can access elsewhere. But here we're looking at household finances. Are they worse off now during the pandemic than they were before the pandemic? So has the pandemic negatively impacted their household finances? Secondly, we look at safety net resources. Have they accessed safety net resources during this period, March through November? Any resources? So first, let's talk about the household finances. In the United States, 38% of caregivers reported that their household finances were negatively impacted during the pandemic, and 43% in California reported negative impact on their finances. For using safety net resources, this is accessing one of 8 resources that were asked about on the questionnaire. For example, accessing the food bank, accessing free and reduced price meals for their children, accessing public health insurance, as well as others too. So did they use at least one of those 8 resources during the pandemic? And about half in the US did access a social safety net resource, and in California, that percentage is 55%. Now let's talk about social safety net resources a little bit more. We're going to dive deeper and say, okay, what about those who were using social safety net resources for the first time? So they never accessed any of these 8 resources before the pandemic, but after March, they did access at least one of them for the first time. Next. In addition to looking at how many were accessing for the first time, we also break it down by income level, because it is interesting to see that even at upper income levels, caregivers were needing to access social safety net resources. In the United States, 7% of those at lower income, below 30,000, were accessed at least one of the social safety net resources for the first time after March, compared to 9% at the higher income level above 100,000. In California, 8% accessed at least one resource for the first time at the lower income level, and 10% accessed at the higher income level. Next. Child safety. Child safety, any kind of violence in the household is certainly a risk to child safety. And here we're looking at it in two ways. One of them, whether the child was spanked, slapped, or hit in the last week. And another one, whether there was intimate partner violence in the household. First, on a child being spanked, slapped, or hit in the last 7 days. In the United States, 16% of caregivers reported that their child somebody had hit their child in the household in the last week, hit, slapped, or spanked them. That's across all households. What we found interesting is there's actually a remarkable difference between those households that have a child with special health care needs and those who do not. The percentages go up quite a bit. So in the US, 21% of caregivers who have a child with a special health care need in the household reported that a child was spanked, slapped, or hit in the previous week. In California, similar, 17% of households overall reported spanking, slapping, or hitting of a child in the house. And if there's a child with a special health care need in the household, that went up to 1 in 4 caregivers reporting it. Intimate partner violence. This is specifically looking at physical intimate partner violence. It does not include, although it does not include sexual violence. In the United States, 11% of households, the caregiver reported that they had experienced intimate partner violence. And if there was a child with special health care needs in that household, that percentage went up to 17%. In California, 12% of all households, but 1 in 4 households, if a child with special health care needs within the household, quite a bit higher percentage of caregivers were reporting experiencing intimate partner violence. Next. Adverse childhood experiences. I certainly wanted to talk about this here because we are with Essentials for Childhood here with this special interest in this area. And on the survey, this is covered in 2 different areas. One of them is the caregiver is asked to reflect on their own adverse childhood experiences before the age of 18. And they're also asked to reflect on their eldest child's adverse experiences anytime overall, ever having experienced it. And this is covering 10 adverse childhood experiences. If you're familiar with ACEs, they're the ones that you would expect about if someone in the household has a drug or alcohol problem, someone in the household has a mental illness, the child is yelled at. So those are an example of the 10 ACEs that were asked on the questionnaire. In the United States, 6% of the caregivers reported that, and also here specifically, we're talking about the child ACEs. I'm not covering the adults reflecting on their ACEs in this slide at all. So 6% of caregivers in the United States reported that their child had ever experienced 4 or more ACEs. And in California, it's 8% that the caregiver reported their child experiencing 4 or more ACEs. Next. So now I want to talk about accessing California data. The data are available on kipsdata.org, and I will show you so that you can take these data and then use them for your own work and to help with improving children's health and well-being, particularly in the time of this pandemic. Next. The Kids Data program is a part of PRV, and PRV started in 1929, And they conduct research and produce data to support evidence-based decision-making on policies and practices to improve the health and well-being of people throughout the world. KIDS data specifically works in the area of children's health and well-being in California. The KIDS Data program, a big part of our program is having this website, kidsdata.org, and we have 57 different topics of children's health and well-being, and those topics are broken down into 8 categories. And so now we've added this 9th category, which is the COVID-19 pandemic, and that's where you can find these data. So at this point, I'm going to jump over to the website and do a live demonstration for where to find these data. And also in the chat box, in a couple different places, you will receive a link to be able to get to these quickly and easily. So I am sharing. And here you see the, Elena, can I see a nod that you're seeing my screen? Okay, great, okay. So here you see the website, and there are different ways to access the data. I'm showing you 2 of the ways. One of them is through the topic page. So here we have the 8 topics, and the new number 9 is at the bottom here, COVID-19 pandemic. And this is the questionnaire that we're talking about today, the family experiences during COVID-19 pandemic. If you click into here, then you see all the indicators, a long list of indicators. One thing I want to point out here is all the data on the website, we have broken out in 3 ways, and those 3 ways are available at the California level. So it's broken out by caregivers' race and ethnicity, by whether there's a child with special health care needs in the household, and by household family income. Now, a second way to look at these data in a way that packages it that might be easier to digest rather than this listing of the indicators is a new landing page that we created to be able to share more in a framework that makes it easier to digest these data. So the link I think is in the chat for this landing page right here, and the landing page is called Child and Family Wellbeing During the COVID-19 Pandemic. And here you will see a description of the questionnaire, some other information along the lines of what I've already shared with you today. But here we have a quick link to the indicators within these topic areas. So I'm going to share one more finding, and that's from positive childhood experiences. So if I just touch on that, I come down to the indicators that are about positive childhood experiences. And specifically, I know I'm going to be looking at people with whom children spent 4 or more hours in the past week. So if I click in there, then we come to the data page. And now this is where you see the data. So we have the indicators, people with whom children spent 4 or more hours in the past week. And what's interesting here is for grandparents, we show the percentage for parents, grandparents, or for other relative, friend, or neighbor. And about a quarter of caregivers reported that their child spent 4 or more hours with the grandparent and children spending time with each other. That would have been between November 9th and December 11th, so a week in that time period. I know whether grandparents have been able to see their grandkids or not, that has been something that has been in the news and talked about. So here we have some understanding of to what extent that grandparents and grandchildren have been able to see each other. A few things I want to point out here. One of them, the sub-state data are on the side here. The counties were grouped into 7 groups across California. So those are large groupings. It was a balance between not suppressing data, being able to show data, and the sample size that we had. So finding that balance, we have 7 groupings to be able to find some sub-state data about any of these indicators that you might want to look at. A few other things I'd like to point out here is to understand more about the indicator that you're looking at, or if you want to see more about something I've already presented in the webinar. It's all down here under any of the tables that you look at. The definition is listed here first, the data source, which I've already described to you. The footnote I want to point out in particular, this provides details that might be important to understanding the data. So for example, I mentioned the 8 social safety net resources. Those 8 would be listed there, so you know exactly what's being counted. Or the 10 ACEs that were asked on the questionnaire. Those would be listed down in the footnote, so you'd be able to get that detail. So that's an important area to just have a better understanding of the data. Also, I'd like to point out that if you want to get those breakdowns, like you really want to look at this by race ethnicity, you go into the change indicator spot and you are able to select whatever breakdown you wanted, and then that would provide you that crosstab after you submit it. And then the last thing I want to point out on this page is how do you get the data? How do you download it and use it for your work? That's in the download function, and you can download it either into a formatted Excel spreadsheet, or you can download it into a CSV file so that you can use it for your purposes, for your work. Or if you like the table as it is, then certainly you can put it into a Word document or into a PowerPoint. So as I mentioned, it's in the chat, the link to get to that page. So if you leave the webinar, you're wondering how to get it, a second place to get to it is from the home page. It is always in the number 2 spot here. You click in here and you end up right back to where I was just a moment ago. So you can access all those data. I mentioned that we will be having wave 2 and wave 3 coming, and so that means more releases of the data. I think I'm very curious at discovering on how it might change, because we have a vaccine now. How is that going to change experiences? Things are changing rapidly. They have been changing rapidly since the pandemic began, but even more so now. So how might this affect the experiences for children and for families in the US and within California? We will announce when we have new data to release for California through our newsletter. And so if you want to receive that newsletter, you can enter it here. And I think there might be a link also put into the chat box. If you enter it there, you'll receive a newsletter twice a month. And what we do is cover a recent data finding and then share whatever is the most recent release on kidsdata.org, which soon it will be wave 2 and wave 3. So with that, I'm going to pass it off to Dr. Segi. Thank you very much for your time.
Lori, thank you. And every time I see kids' data demonstrated, it's just so wonderful that you've made the data available for people to look at their own local or county level and sliced and diced any way they want. Before I go into the national data, just to a little more about the background, both the American Academy of Pediatrics and Prevent Child Abuse America, each of them have large networks of providers who have been caring for families affected by the pandemic, of course. And the survey was conducted with the help of the CDC to look and see what's happening in families during the pandemic, particularly what's happening with family violence. There's been a lot of discussions about that. But in the process of creating this survey, we of course looked at all of the factors that are going on in families that might influence that. I just want to start out by saying that the survey was what's called an internet opt-in panel. We work with an organization called YouGov.com, which is a company that has millions of Americans who've signed up to take surveys from time to time. They offer surveys, people take them, and there's some kind of very minor amount of reimbursement for them. So it's not a random digit dial survey. For those of you who are survey geeks, there's a lot of conversation about who actually fills out which kind of survey. But YouGov.com gives sample weights. All the data we're presenting are weighted. And our sample that I'll be talking about from a national point of view is 55% white, 12% Black, 1% Native American, 23% Latino, Latina, Latinx or Hispanic, and 3% Asian. So clearly we've been able to achieve a balance by race and ethnicity. And just the other thing to remember is that the entrance criteria for this study or this questionnaire is they have to be the parent or caretaker of a child. So the age distribution is different than the age distribution of the entire US population. Only 4% of respondents were 65 and older, and only 6% were 18 to 24. 63% of the respondents were 25 to 44. So it tends to be a little bit younger, but not a lot younger than the US population. So with that, I can go to the next slide. The first thing that we did, sorry, I talked about this slide already. The national questionnaire is being presented. Okay, so what the AAP is doing with this now is presenting the data as snapshots of American family life during the pandemic. And it appears on AAP websites that are available to the general public. And there is specific outreach to pediatricians because there are 65,000 pediatricians who are members of the AAP. The first message was about family stress and closeness. And we see on the next slide is that, as Lori discussed, most families are experiencing huge disruptions. 6 in 10 children had the school closed nationally, and as Lori discussed, all kinds of other things. Altogether, 80% of parents said their children's lives were disrupted. And this is parents of children from 0 to 18. On the next slide, we then asked parents, when you help your child with their education, is this a stressful experience? Does it increase tension in the family? That was one question, and it was a scale from never to always. And the second one was, does helping your child with their education make you closer or led to a deepening or led to positive experiences with your child? And what we found was families are experiencing both. So if you look at this Venn diagram, 48% of families said that they were stressed, severely, stressed during the pandemic, and 60% said they were having positive experiences with their child. But look at the overlap. The majority of families who had stress also had positive experiences, and nearly half of those who had positive experiences also had stress. And we thought this was important because if you read the media or think about it, people know about the stress that families are facing. The other side of it is what we would expect from knowing about human relationships, in particular post-traumatic brain growth that occurs when people have a big shock to their system, which of course having kind of the world shut down on one day is a shock to the system. So the next slide, I want to show you the messages that the American Academy of Pediatrics developed for pediatricians and for others who are interested in talking to the public. First, most US children have experienced disruptions. Second, school disruptions have caused tension and stress. And there's a lot more to talk about there, of course. And finally, despite the disruption and the tension and stress, most families have grown closer together. And these are really important messages for providers to know, whether they're pediatricians or home visitors or anyone else. The next slide, we talk about the financial implications. And here, Lori's presented some of this already by comparing the California and national data. But I want to, so what she said was that, and it's correct, nearly that 47% of families had their household finances more or less the same. 40% of families with children at home had their finances negatively impacted, and only 13% and one in 8 had them positively impacted during the pandemic. Nearly half of families across the United States accessed government resources. And for those of you who are listening who are advocates, these resources clearly helped stabilize families because we know there have been enormous changes in employment status. So since the pandemic, 38% of men and 38% of women have been laid off or had their hours reduced or lost their jobs by their employer due to the change in business situation. 48% of women and 56% of men had no change in their employment status. The difference here is that 14% of women said they reduced their work hours or left their work in order to care for children, and 6% of men said that they left their work or reduced their hours to care for children. Now, 6% is a pretty high number, and 14% is a very high number. So a lot of families were not just laid off, but because of the additional demands of having children at home, simply couldn't work at their former level. So we think that part of the reason why more families weren't negatively impacted is things like extended unemployment insurance and in stimulus checks and other opportunities the federal government made available. So if I can look at the next slide, what we know is that when families get stressed, so these are the messages. Employment loss has affected family life. And we talk about the employment loss both being laid off and parents love their children and they're going to do what they need to, even if it means reducing the household employment. Many families rely on government resources, particularly during the pandemic. And we know from much literature that financial stress can lead to tension and violence. So the next set of slides is going to look at the tension and violence seen in American families. First, Lori mentioned that spanking is reasonably common. 13% of families report spanking. What this means is that 5 out of 6 American families did not spank their child or said they didn't in the past 7 days. And there's always a question about what surveys mean, are people telling the truth or not. What we've seen is that over decades, the number and proportion of American families who hit or spank their children has been declining. And this data suggests that this decline is continuing. And it's not that parents let their kids run wild. We also asked about a series of what are called positive disciplinary techniques, explaining things, putting a child in timeout, sending them to their room, or distracting them. And you can see that families used these positive discipline techniques to teach their child right from wrong. On the next slide, we dig in a little bit to some of the understanding of who spanks the child and why. And the first thing is, Lori talked about ACEs. She talked about children's ACEs. It turns out that adults who had one or more ACEs were far more likely to spank their children than adults who did not. So 9% of parents who had no ACEs reported spanking their child in the past week, compared to 21% with one or more ACEs. On the next slide, what we can see is that there's a strong association between intimate partner violence and spanking or hitting your child. So on the graph, you can see where there is intimate partner violence at home, 61% of those families reported spanking their child, compared to just over 10% of those where there was no IPV. And when we include other forms of harsh discipline, like threatening or yelling at your child, the numbers get even higher, 75% and 45%. So this actually suggests that when you hear that a child's being spanked, really think about the safety of the other people in the house. We also looked at parents who felt nervous or stressed most or all the time, or who felt their difficulties were piling up too much to handle. And those parents also spanked their children 20% more often than others and were 14% more likely to use any form of harsh discipline. So here are the messages that we get from there, shown on the next slide. First of all, just reinforcing the message that most parents avoided harsh discipline techniques. And incidentally, we have not analyzed this particular data set by race and ethnicity, but all of the recent data shows that there are few differences between people based on their race and ethnicity. The big differences are generational. So parents, young people who are raising their young children, are avoiding harsh discipline techniques. In fact, fewer than half use any harsh discipline technique, and only 1 in 6 spank their children. And the important thing to remember is that it's the parental circumstances that have the strongest association with the way parents discipline their children. So parents who are experiencing stress or intimate partner violence or financial stress are far more likely to spank their children than parents who are not having those experiences. And I think from this, one of the approaches that we need to make is really understanding what's going on with the parents, as well as talking about the child's particular behavior. On the next slide, continuing the theme of what's going on in American families, there have been many news reports that intimate partner violence is been increasing. And we saw that as well. Intimate partner violence for men and women was high across socioeconomic status. We only asked about psychological abuse and physical abuse. This survey did not include questions about sexual violence. And we found that both men and women were experiencing domestic violence at high rates. And what this graph shows is that this is particularly true for low-income families with incomes of less than $20,000 a year. And we know that poor families are financially stressed. If they can't meet the basic needs of food and shelter, they are, of course, more stressed and more likely to feel relationship stress and even violence. And from an advocacy point of view, this goes back to some of the things that are happening now with child tax credits and other ways to support parents so they don't feel this level of stress. Finally, those who are experiencing IPV also felt more nervous or stressed, had unhealthy coping strategies like drinking, smoking cigarettes, that sort of thing, and as we talked about before, reported more spanking or hitting the child. So the next slide shows the messages that are on the American Academy of Pediatrics Snapshot page. First, intimate partner violence was high for both men and women since March of 2020. It's higher than the historical averages that we've seen in other surveys. Financial stress was associated with high intimate partner violence. And in homes with intimate partner violence, children are at risk of harsh discipline or spanking. Of course, we can't actually ask about child abuse for a variety of reasons, but we suspect that some of those, there's a long association between IPV and child abuse as well. So of course, we're concerned about that. Next slide. So I think Lori and I just want to thank you all for listening. On the next slide, if you want more information about healthy outcomes from positive experiences, we have a website called positiveexperience.org, where you can email us at hope@tuftsmedicalcenter.org. And now we've tried to leave plenty of time for questions. So I'm going to be quiet and let's hear if there are some questions or concerns or either about the way the survey was done or the results that we found, or if there are experiences that people who are joining us today have with themselves or people they care for during the pandemic. Please chime in.
Thank you, Lori, and thank you, Dr. Segi. I'm just checking for questions right now. There was a question about whether or not the session will be recorded and if a link to the recording will be sent out. And the answer is yes, the session is being recorded and it will be posted on the California Essentials for Childhood Initiative page on PACE's Connection. And we will, yes, send out additional details, including the PDFs of slides. Mina White, I think at a certain point I saw you raise your hand. I was just curious if you have a question you wanted to share as well. Oh, nope, that was not a question. Very good, thank you.
So,
and there's a question, go ahead.
Oh, please go ahead, Elena.
Oh, okay. There's a question from Jane Wellenkamp about, is the survey available? Lori, would you like to answer that one?
Sorry, it caught me. I'm having my hand on the mute button. Actually, Dr. Segi, that might be better for you to answer.
Okay, please ask the question again. I'm sorry, I was listening for Lori.
Whether the survey instrument itself is available?
If you're interested in the survey instrument, I think send us a note and we'll put you in touch with people at the American Academy of Pediatrics, who are the prime group. We're happy to share. It's a group project, so we're trying to send everything through there. Send an email to hope@tuftsmedicalcenter.org, and we'll put you in touch with people who can do that. Most of the survey items were not new or novel. We worked together with the CDC and the survey folks at Prevent Child Abuse America to take questions with permission from other validated instruments. So we're happy to share the questions, but if you're looking for novelty, you probably won't find it.
Thank you, Dr. Segi. We have quite a few questions. So the next one is from Jennifer. I might have missed this, but are there any plans to do a follow-up survey? And Lori or Dr. Segi, is there one of you who might like to take that?
So this is the first of 3 waves that we're reporting today. The second wave just completed data collection last week. So we should have data soon from that. And there will be a 3rd wave this summer, so we can see how things change in families. And if anyone from the CDC is listening and they'd like to renew the contract, we'd be happy to continue doing this. I wasn't supposed to say that, I'm sorry.
Thank you. Thank you. Then there's a question from Teresa about, will the kids' data results for COVID-19 be viewable by region? Lori, did you want to share about that?
Sure, it's viewable for 9 regions in California. So some of those data, some of the regions are suppressed, especially the smaller county area, for some of the indicators, just because of sample size. We had 1,500 respondents, and so we, in order to have valid, reliable data, we did the best that we could for 7 regions within California.
Thank you very much.
I noticed that Gloria Earl asked a question of the numbers available on the website for the percentage or number of individuals who took the survey by race. I know for the national data, it's available at the AAP website. If you follow the link that was sent earlier, in the article about it, one of the links is about this survey, and it presents all of the demographic data.
And for the California level, it's presented on that landing page that I showed. One of the paragraphs is about the what the percentages for race, ethnicity, gender, children with special healthcare needs, all those types of demographics are written into the paragraph.
Thank you, Lori.
Or on the beginning of this webinar.
I also see a question in the chat from Rosalind, who asked about sexual violence is underreported. What efforts are being done to promote universal screening for sexual violence and universal screening for IPV, so children and families can reach out for support? So I can only speak as a pediatrician and as a person who's done a fair amount of professional education before and during the pandemic, the AAP asks for screening for domestic violence at-will child checks. It provides guidance for how to do that, particularly in the first year of life when domestic violence is so highly prevalent. That's the good part, and many practices are doing that. Here's the bad part. It has been difficult or impossible to do that with telehealth, because if you're in a doctor's office or some other one-on-one environment, you know who's there, who's listening and who's watching. In a telehealth environment, you can't really be assured of privacy. So I think there's been a big struggle for understanding how to do those kinds of difficult questions where the person might not want to disclose if someone else is in the room. So one of the strategies that people are using is saying, you know, in this time, there's a lot of problems at home. Here's some resources for domestic violence if you know anyone who may need them, in case someone else is listening. And I think that's been difficult.
Thank you, Dr. Segi. Go ahead.
I see a question from Gail, which says, how are you sharing this with policymakers, wondering if federal and California policymakers are aware of these findings? We're just at the start of this. Since we just, for California data, we started releasing the first parts of the data in February, and we've been just releasing it as we're able to clean the data, go through it until 2 days ago, we released the last of it. So now we have the full complement of wave 1 data available, and now we can do our broader outreach to say, look, all this is here. So this truly is the first webinar that we are doing on this work to share out there. So this is just to get it. Dr. Segi, did you want to say more about the federal, what might be happening at the federal national level?
Yeah. Both Prevent Child Abuse America and the American Academy of Pediatrics advocate for children and families in various ways. And some of the data that we shared with you today about the financial resources available to family and their dependence on safety net things are being included in information for the public and for their advocacy efforts.
Thank you both. There's also a question from Monica that occurred a little bit earlier in the chat, asking about, did the survey samples reflect underserved and underrepresented communities? And also, will this webinar be available? And I'll answer the second part of that just to be double sure that we mention this, is that it'll be posted on kidsdata.org and also on the Essentials Pieces Connection page. But Lori and Dr. Segi, did you want to share anything else about the underrepresented and underserved communities as well?
That data were weighted to reflect the child-caring giver population, those who are taking care of children 0 to 7. So it should be reflecting. So but did not oversample for African American or Hispanic or other specific groups, if that helps to answer the question.
Yeah. It's really hard to tell who actually answers a survey other than the demographics. So only 55% of the sample was white, which roughly corresponds to the demographics of the country. And Lori and I both showed data that shows that there's a group of people who are making less than $20,000 a year in family income. So low-income families are also quite well represented in the sample. The other thing I want to say is that some of the questions are very time-bound. Other questions maybe not so much. So at the end of this, we'll have 9,000 individual parents who will have contributed data in the national sample. And that will give us the opportunity to do some important subgroup analyses to look at race, ethnicity, poverty, other issues that one can distill from this kind of data.
Yeah, that is an important thing to note, that the questions, as you look through the data or you look through the national data snapshots, some of the questions are asked in the past week since the start of the pandemic. So make sure to be aware of the time period that the question is referring to have a good understanding of the information that's being shared.
Thank you, Lori. There's also a question that's asking, can we have the race and ethnicity information again, from Marty? And Marty, perhaps we could go back a few slides to show that.
Are you able to share, if I can share the screen, I can show that to you.
Sure. Yeah, hold on just a second.
Oh my gosh. Can't read it. 13 is where I shared it for the US sample and California sample.
Can you all see this now?
Oh, there we go. Okay.
Yes, we can.
This is from the American Academy of Pediatrics website. You can tell it's got this fancy animation, but this is the age, gender, race, and ethnicity data. And I don't think there's a blow up of the family income, but there's a broad range of family income, including very poor families and a few many families over 100,000 and many with under $20,000 in household income. Does this answer for the question? If you can just put in the chat box if this answers your question, or if you need more data, you can certainly get it from kids data for California.
Thank you, Dr. Segi. And that is all the questions that I am seeing from folks. So I just want to say a huge thank you to Dr. Lori Turk-Bochachu and also Dr. Segi for presenting on this webinar. It's sincerely appreciated. Thank you so much for your hard work to bring this information to this group, and also just the amazing information that you presented here. I think it's very timely and needed, and something that I know that a lot of folks are really interested in. So thank you very much.
Thank you so much for inviting us. And,
yes, thank you.
And I just am going to share my screen just for just a moment, just to share just a couple closing pieces with you all. One is about a resource that you may know about already, but if not, we definitely wanted to share it with you. The Department of Social Services is funding the California Parent and Youth Helpline. And this is a resource that provides support and resource referrals to parents and youth during the COVID-19 pandemic, 7 days a week from 8 a.m. to 8 p.m. There's information here for the phone line, as well as chat services. And they're available in English and Spanish and other languages as well. And more information can be found on their website. And then also there's just a couple links that might be of interest to you that have also been placed in chat. One is for the PACES connection page, where we mentioned that the details of this webinar, including the PDF of the slides, and also the webinar will be posted there. Some information certainly about kids data, where to access their resources that Lori was speaking about, and also the HOPE Positive Experience Framework as well website. We wanted to just mention just quickly a couple Caltran trainings that are coming up that might be of interest to you from a partner that's funded under social services. There's a Protective Factors 101 series coming up May 6th through June 24th. And the link that will come in this PDF will take you straight there to register. And then they also have another several other series on understanding poverty. And the webinar, again, the link when you see the slides will take you to register. And then finally, we just really are curious about your thoughts about this event. And we would be sincerely grateful if you would share how you felt about this event and the information you received by clicking on this or utilizing this link. Or I understand from my teammate, Natalie Herlock, if you open your phone right now and go to the photos component of your phone, and this QR code on the left-hand side of the screen will bring you to the website link that will allow you to quickly answer the survey. And we would just be sincerely appreciative of your feedback. It helps us figure out how to do better and bring you information that's useful and helpful to you. And so I just sincerely appreciate you all, and we have the gift of time, which is always nice. I know in days when we're on Zoom, and thank you so much.
Thank you. Bye-bye.
Thank you.
Thank you.